Welcome to Stanley Regional Medical Center, where your anticipation ends and your memories begin. Although your delivery may seem a long way off, these months will go by faster than you think. Taking care of you and your baby is very important during this time. Our comprehensive maternity services at Stanley Regional Medical Center are designed to make your labor and delivery safe, comfortable, and a memorable experience. Since some babies come unannounced, we recommend you pack a bag ahead of time with items such as comfortable going home outfits for mother and baby, robe, nightgown, socks and slippers, underwear and nursing bra for breastfeeding, toiletries, lip balm for dry lips, hair barrettes or headbands, books, cards, or music to pass the time, and an infant car seat. When in labor, be sure to enter through the Bivens Outpatient Center during weekdays and through the emergency department at night or on weekends. With 12 postpartum rooms, a state-of-the-art cesarean birthing suite, a nursery, and 6 spacious labor and delivery rooms, we strive to create a home-like atmosphere by truly taking pride in offering quality care, delivered with world-class customer service.
In our Women's Center, we have 6 spacious labor and delivery suites, and it's our preference and our hope that the moms will be able to stay in these rooms throughout their stay. However, since there are only 6 rooms, there are times when we have more patients than we can accommodate, and we may need to move you to one of our postpartum rooms. In those rooms, you will have the same nursing staff and the same excellent level of care.
If you have a scheduled cesarean birth, only one support person is allowed in the surgical suite. However, for vaginal deliveries, up to 3 visitors are permitted in your room during delivery. We realize the importance of educating parents-to-be about pregnancy, delivery, and positive parenting skills. So to further complement our services, we have partnered with area agencies and organizations to offer the Embrace Educational Series. These free prenatal classes are held at Stanley Regional's Family and Education Center for women delivering at our hospital, as well as any Stanley County resident. Sometimes when a woman is nearing the end of her pregnancy, she may have her labor started or induced rather than waiting for labor to begin on its own. When labor is induced for non-medical reasons, for matters of convenience or preference, it is called elective labor induction. Elective labor induction isn't always best for a baby. Inducing labor before you're at least 39 weeks along in your pregnancy has risks. It is important to consult with your physician to help determine if and when elective labor induction is okay for you and your baby.
At a minimum, 39 weeks is a standard, and that if you choose not to abide by a standard like that, then your baby ultimately has a 2 to 3 times greater risk of being admitted to the neonatal intensive care unit. They have a greater risk of being confined to an incubator because they're having problems regulating their temperature, or to a ventilator because they're having problems with breathing. And what does that do to you and your baby? Well, it creates a barrier between the two of you because it prevents you from bonding, because it makes it almost virtually impossible to do that when they're being hooked up to monitors on a continuous basis, because we chose to do that prior to 39 weeks.
Cameras are permitted during labor and delivery at the discretion of the staff. However, we ask that you reserve videotaping until after the delivery. It is also important to be thinking about your baby's pediatrician before he or she arrives. Stanley Regional has a number of board-certified pediatricians on staff ready to care for your little one as soon as the big day arrives. He or she will examine and screen your child for possible complications or birth defects, including a hearing screening, which takes 15 minutes and is painless.
An expectant mother who's looking for a new pediatrician will a lot of times hear about other pediatricians through word of mouth and other people. You could also go online to stanley.org to have a listing of all the pediatricians in the area. Most of the pediatric offices, and all of them associated with Stanley Regional Medical Center, have a complimentary prenatal visit where you can come in and talk with the pediatricians and interview one of them and kind of see the practice's perspective on delivery, and they'll walk you through the process of the delivery and what to expect in the hospital and when you go home.
In the event your baby needs additional care, We have partnered with Carolina's healthcare system and provide rapid delivery to nearby neonatal intensive care units at either Levine Children's Hospital or CMC Northeast. To ensure the safety of your child, we have a state-of-the-art security system to prevent the abduction of an infant prior to your discharge. In addition, you, your baby, and your support person will all have bracelets with matching numbers shortly after delivery. Our nursing staff will only give the baby to you if your bracelet is intact and the numbers match. Likewise, never give your newborn to any staff member who is not wearing a special pink employee name tag, signifying their security clearance. This is just a stork's eye view of what we will offer you and your family during your delivery at Stanley Regional Medical Center. To learn even more, visit our website at stanley.org, where you can also subscribe to our weekly e-pregnancy newsletter. Congratulations on your pregnancy and for choosing Stanley Regional Medical Center for the delivery of your child. For an excellent birthing experience where memories begin, look no further. We're right here beside you.